Hi, I'm Suneel Chilukuri, board certified dermatologist in Houston, Texas, and I'm excited to share some data and some perspective from a board certified dermatologist to you and the public as well as our colleagues. A lot of times patients come in and all they see is that little blemish that they have on that day. And you look at them and you say, well, you have two little spots on your face, or maybe one on the neck, a couple on the back. What we're not always paying attention to is what's the scarring that's visible physically, as well as the internal scarring, meaning the mental scarring. Because when you do have multiple blemishes, and this happened to me this past weekend, where literally I had this thing growing out of my nose that had its own zip code. And with that, I was definitely more self-conscious in the conversations that I had. I was running to the drugstore trying to find something to cover it up because it does. It's a confidence that it decreases your confidence in general. So when we talk about acne, we're not just talking about what do we treat that's there at the moment of the visit, but we're treating the scars that are also going to be forming afterwards. So how do we prevent that? When you're using something that's going to have a topical salicylic acid, that's going to be an anti-inflammatory. Again, something that's super accessible, you can buy on Amazon. One of the best companies out there is called Panoxyl. A lot of research that's done. You can also use adapalene or a retinoid of some sort. If you can't get to a dermatologist or your doctor to prescribe a tretinoin, you can get something that's over the counter now, which is called adapalene. So a lot of different companies are carrying great adapalene products. And what we can do with that is prevent some of the dryness that comes on because you're increasing the cellular turnover to every 7 to 10 days versus every 38 to 42 days in those patients who have acne. You're going to be able to shed some of the skin. You're going to decrease the scarring, decrease the erythema or redness, in addition to treating what's there on the skin itself. So I think this holistic approach allows us to be healthier, both again, physically as well as mentally inside. When you look at the space of microneedling or collagen induction therapy, there's been so much progression that's occurred over the last 15, 16 years. When I first introduced it into my clinic, it's because I got to train with a gentleman, Des Fernandez, who's first described this in the 90s in terms of using a little stamper. And on the end of that stamper were all these tiny needles, and we would stamp. And we're using it to help those patients who have a lot of actinic damage, who are probably going to produce some type of squamous cell or basal cell, so we can reset the skin. We found that it works incredibly well for even active acne, and of course for scars that we see post-acne. When you're in this space, there's so much that's not data driven. And what we find is to get in front of the FDA to actually have proper clearance, it took a lot more effort. And that was actually an 8 to 9 year project before SkinPen became the first FDA-cleared microneedling device. What allowed it to get through is the clinical data that's behind it. What continues to make it lead the overall microneedling space, even though there's all these other brands that are trying to come out, there's only 3 other brands that are FDA cleared. So why do I personally pick SkinPen inside my clinic? Because the unique portion is on the tip itself. It's not just the sterility. A lot of these different companies are coming with very sterile products. But the tip itself, the mechanism, it does insert so that you have to have a powerful motor, but it also retracts. It actively retracts those needles. So when you're treating thicker skin, when you're treating scars, when you're treating keloids, it allows you not to scratch the skin or get stuck in that scar. So that's the biggest advantage of the SkinPen versus some of the other products that are coming down the pipeline, even if they're FDA cleared. The second advantage is going to be the motor. So when you have a powerful enough motor, you're going with enough revolutions per minute, you're able to glide that on the skin very smoothly without creating marks or pain. So that's the biggest benefit of SkinPen compared to anything else that's on the market. So in our practice, at least at the moment, we continue to use SkinPen because it is the most advanced product that's out there. They have multiple millions of people that have been treated safely and on all skin types. I think in terms of Acne Awareness Month, it's really nice to just have the conversation. And remember, you don't always have to go see a dermatologist, but you do want to see somebody who's an expert in that particular arena of acne. What we're finding now with social media, it's a great avenue for learning and putting some information out there, but make sure that it's vetted information and make sure that it's actually accurate. Check that person's credentials and see does it make sense when you put it through, let's say, even a chat GPT or some type of AI program? Make sure that it's not just garbage out that you're taking in, right? You want to make sure that you have proper data and that you're not going to harm yourself. So when people talk about putting on beef tallow and all these other products that are going to actually cause more acne, I say be cautious, check your source, and then always ask an expert.